The Presidential Task Force, PTF, on COVID-19 says available records show that there is a global decline in cases of COVID-19 and deaths. The Minister of Health, Dr. Osage Hanire, made this known at the PTF National Briefing in Abuja. He, however, emphasized that those on home-based care should report to their hospital or case manager immediately they experienced symptoms or felt their symptoms were getting worse. He said there were reports of an offer of 300 million doses of Sputnik V vaccines to the AVATTA portfolio, which would boost availability to 557 million, adding that it would be a great relief to the African region and also increase the variety of vaccines to 4.
And the trend in reduction compares with global observations of a seeming decline in COVID cases, signifying that the second wave may be receding. We are, however, not drawing any conclusions at all, and certainly not declaring any victory, but rather we are watching developments as they unfold nationally and internationally, ready to make use of any comparative advantage that may emerge. In the meantime, there is no room for relaxing in our public health measures of wearing masks, social distancing, and respiratory hygiene measures. We are intensifying the monitoring of treatment of COVID-19 positive cases, especially those that can self-isolate, by strengthening and improving the capacity of personnel to manage home-based care. However, I wish to emphasize that those on home-based care must report to their hospital or case manager immediately they begin to experience symptoms or feel that their symptoms are getting worse. Experience has shown that COVID-19 disease can deteriorate suddenly and rapidly, resulting in life-threatening severity that could be managed if presenting to hospital early enough. Late presentation is a leading cause of the increase in mortality. Findings from supportive supervision of treatment centers also indicate that vulnerable and at-risk persons are among those who are reluctant to accept hospital admission, especially if they feel they have no severe symptoms. It is important to follow medical advice and comply with directives. The hospital bed occupancy at our isolation and treatment centers is about 36%, so there is sufficient space to comfortably accommodate patients. And we, in fact, also stand ready to redistribute patients from heavy burden to lower burden hospitals if the need arises. We have reports of an additional offer of 300 million doses of Sputnik V vaccine to the AVAT facility, to the AVAT portfolio of the African Union, which boosts the availability of the AVAT to about 557 million doses of vaccines. This will be a great relief to the African region and also increase the variety of vaccines to 4. The Vaccine Coordination Committee will advise on the best options for Nigeria, bearing various salient factors in mind.
Speaking on Ebola and Nigeria's preparation to forestall any outbreak, the minister said Nigeria was closely observing development on its outbreak in Guinea and working with the West African Health Organization, WAHO, to contain it and prevent the spread to other countries in the region.
Nigeria is closely observing developments of the outbreak of Ebola virus disease in Guinea, and we're working with the West African Health Organization led by Professor Stanley Okolo to contain this outbreak in the outbreak country of Guinea and to prevent the spread to other countries in the region. We have offered West African Health Organization support from our teams in Nigeria who have experience from our Center of Excellence in viral hemorrhagic fevers to support them if the need arises. But we are pleased to note that the ECOWAS countries adjacent to the epicenter are also taking strict measures with regard to checking movement of persons across their borders. And this reduces the risk for the African sub-region, West African sub-region. Our Port Health Service officers are on high alert to step up border surveillance of travelers arriving by air or overland from destinations around the outbreak center. Although Nigeria was classified as a moderate Ebola risk country because of our distance from Guinea, the health workers in our hospitals have also been put on alert to have a high index of suspicion, and we also hereby use this as an opportunity to alert the population to report suspicious persons with suspicious symptoms, including fever and bleeding, who have a travel history or have recently arrived from any of the West African countries. I want to use this opportunity to advise Nigerians intending to visit countries in that general area to first of all delay their visits while the World Health Organization carries out supportive activities which include ring vaccinations. As we all know, there are vaccines already available for Ebola disease. Happily, we are also hearing that there have been no major increases or no serious increases in or suspicions of more of these outbreak cases in Guinea.